Welcome back this is my lymphoma story. This is part 7. I've named it Intensive Care. Thanks for continuing to watch my videos. Please like and subscribe if you'd like notification of when I release other ones. I'll continue to release more. As in part 6, I mentioned my infusion took place on the 16th of July 2024. This video covers how I got on in the weeks after infusion from a recovery perspective, and what you might be likely to expect going forwards if you're looking to receive the same treatment. So my infusion was on the 16th of the 7th, as I said. There's many side effects that you can receive with CAR T therapy. Some side effects can occur up to eight weeks after date of infusion. So it takes quite a long period of time to get through it all. A few serious side effects. Two main ones that they seem to be, the doctors appear to be more concerned about than others. There's two. One's called CRS and the other is called ICANS. CRS, I'm reading this, stands for cytokine release syndrome. CRS is one of the most common side effects that can be endured. It's things like fever, the chills, rapid heart rate, low blood pressure, low oxygen levels, headaches, basically flu-like symptoms that you have to endure. I think they usually occur within the first 10 days. If you're going to get it, if you pass that and you haven't got it, then you probably managed to avoid it. I think most people tend to experience it in one form or another. That's one of the ones. The other main one that they seem to be very concerned about is the ICANS. ICANS stands for Immune Effector Cell-Associated Neurotoxicity Syndrome. Basically, ICANS is a serious side effects. It's where your brain starts to become affected and not working correctly. Symptoms are things such as confusion, speech, difficulty with your speech, handwriting difficulty and memory issues, headaches, dizziness, speaking, shaking, tremors, movement difficulty, and drowsiness. So I was that's what they keep an eye out for, and obviously then they start to treat you to combat any issues if you do experience either of those. I was unlucky enough to experience both CRS and ICANS. CRS for me was mild. Classed as mild, and it was mild. It was mild flu-like symptoms and just a bit unwell, and so it required me. That wasn't so bad. However, my ICANS did require me to be moved into intensive care. Hence the reason I named this part of my video story Intensive Care. In order for the doctors to monitor you and see how well you're progressing, and to recognize if you are struggling from ICANS, your complete checks. For me, they were every 4 hours. Whilst everything was good, they're every 4 hours, and you're asked to do a little quiz, a series of questions. It's the same questions every single time. So you shouldn't get them wrong. What's the name of the hospital? What hospital are you in? What month is it? And occasionally they'll pick up items like a pen or a cup or a fan, or point to different things and ask you to say what they are. All straightforward, really easy. You shouldn't get it wrong, really. So if you do, it's pretty clear something's not right. And the other part of the test is they ask you to complete a sentence and write that sentence down on a bit of paper. For me, I chose, my dog's name is Dudley. They wanted a little bit more than that. So I added on the end, "He's a good boy!" exclamation mark. So every 4 hours I had to do answer the questions and write the sentence. And you're writing the same one every time, so you shouldn't get it wrong. It should be straightforward, it should be easy. However, how they recognised for me it wasn't quite right. I started to struggle to write my sentence. I was trying to start the sentence with M for my dog's name, and I just wrote a series of M's all the way through the bit of paper. So I think that was enough for them. They moved me to intensive care and start treating you, usually I think with steroids, which I think help with inflammation and things like that, to try and reverse the wrongs that's happening in your brain. And you carry on continuing with the checks and doing your sentencing. And I kept writing my sentence, and actually progressed and got worse initially. It went from just M's to being complete squiggles right across the page. To the point where massive load of squiggles, to the point where I was unable to write anything at all, and then even worse, I couldn't even hold the pen. So that was tough, and then slowly you start to return, and you are able to start writing your sentence and answering your questions, and that's a clear indication that they've managed to put things right. When that happens, when they deem you well enough, you return to the ward. But prior to that, during the experience, there's many other checks that they do as well, just to make sure they're on top of everything. So I was in intensive care from the 21st of the 7th, 24. Other checks that they did included a head scan, which I did on the 21st of the 7th, 24. And then an MRI scan the day after on the 22nd, an ECG check again on the 22nd. So they're monitoring everything, all different parts of the body, just to make sure that how you're getting on. And then released from intensive care in the end on the 24th of the 7th, back to the ward, to my normal ward. It's an incredibly scary time, going to intensive care. Not for me as a patient personally, because I wasn't really aware of everything that I was going through and what I was experiencing, and I don't think you understand really how risky it can be, how dangerous it can be for you, and what you're going through. But for family, extremely difficult. My partner was with me at the time and was witnessing all of this, and extremely scary for her to sit through. Must have been a really tough time. I've been told by her that it was very tough at the time to see someone you love going through troubles like this. Thankfully, they rectified everything for me, and I came out the other side and returned back to the hospital ward. Because I'm from Guernsey in the Channel Islands and my treatment took place in Southampton, I didn't have any residency near the hospital, so I had to stay in hospital longer. So I stayed in hospital until the 13th of the 8th, 24. So quite some time, about 5 weeks in total for me. And then they deemed me fit enough to return home, fly home to my little island, and then continue recovery. Slowly things improved, very fatigued to start with, and you slowly work on that, starting to walk a tiny bit further every day and try and get it back. The worst thing for me since has been my immune system. I'm now immunocompromised due to the treatment, so I've really got to be careful with catching infections and things like that. So you can catch it from anybody, busy places and things like that. So I think you need to be sensible with it. I do. I try and avoid busy places unless it's essential, like doctor's surgery or something like that, or a hospital. Obviously, you've got to attend those from time to time. But generally, if I meet people, I ensure that they're happy, that they feel fit and well, so they're not likely to pass anything on. I walk outside with friends and things like that, so it's okay. You just need to be sensible with it, really. That's the worst thing now that I have to endure. So I'm going to talk about more about those sort of bits and bobs in my next part, which will be part 8. So as always, I'd like to thank people for watching. Please like and subscribe again, just a quick reminder, because it will help me and it'll help the channel get pushed out there to people in the hope that it can help someone going forwards. I've already received many nice comments from people and emails, messages thanking me and saying that it's helped them, so that's nice. So it's nice to see. That's the aim of the whole project. So please like and subscribe if you'd like to see more. Hope you've enjoyed this part and look forward to producing more for you. See you soon, and thanks for watching.